The Institute for Development Research, Advocacy and Applied Care, Idraac, is a non-governmental organization founded by experts in the field of mental health who have been conducting research and work in mental health in association with the Department of Psychiatry and Psychology at St. George University Medical Center, Balamand University, Faculty of Medicine, since 1982. Idraac's mission is to conduct and promote research in mental health on national, regional and international levels, in collaboration with national and international organizations, to increase public awareness of mental health, to implement community interventions, and to reach out to policymakers to address mental health on a national level. Idraac has several areas of interest in the field of mental health, and over the years has conducted several research projects on community, clinical, and national levels. In extreme circumstances such as war, Idraac participates in relief efforts directed towards the community and the suffering individual. After the Grapes of Wrath military operation in 1996, Idraac, with the support of the Dutch Foreign Ministry, UNICEF, and the Hariri Foundation, set out to evaluate the mental health of traumatized children to implement relief interventions for the distress these children were suffering from. Idraac provided training and supervision to hundreds of interviewers, teachers, administrators, and school health personnel, providing them with skills to help the traumatized children. Treatment was provided to 2,500 children and adolescents, and many orphans, for a period of up to 5 years. The research completed, and the skills that Idraac has acquired since the Grapes of Wrath War in 1996, allowed us to play an important role in the care of children, adolescents, and adults after the July 2006 war. After more than a decade of peace and prosperity in Lebanon, the last 2 years saw a series of security events which threatened the safety of the Lebanese and brought mental health issues to the fore. Idraac, along with St. George's Medical Center and Balamand University, offered free mental health consultations and care to affected individuals of all ages during this unstable time. A hotline was set up, which was announced on TV and radio. Experts from Idraac helped people, answering their questions and giving general preventive directions in mental health care by appearing several times a week on a call-in radio show. Members of our group also offered all the psychiatric care that Doctors Without Borders was providing to the thousands of refugees through their mobile clinics. With the help of the United Nations Population Fund, UNFPA, and a number of local partners, Idraac conducted assessments in the most war-affected areas, the south of Lebanon and the southern suburbs of Beirut. Idraac assessed the mental health and the psychosocial needs of women in these areas for the purpose of planning short and long-term interventions and initiatives to help and support women in the various geographic areas affected by war. Handicap International, funded by the European Union's ECHO program, commissioned Idraac, through the Higher Council for Children in the Ministry of Social Affairs in Lebanon, to do a full assessment of the psychosocial needs of Lebanese children and youth. Information was collected on every village in the war-affected areas, in order to match the needs of children and their families with the available resources and services related to mental health and psychosocial matters. In 2001, Lebanese government officials and the United Nations Office on Drugs and Crime, UNODC, approached Idraac to do a study to assess drug use and abuse in Lebanon. Drug abuse was researched in rehabilitation centers, hospitals, jails and schools. Idraac then produced a full report on drug abuse in Lebanon and a set of recommendations that were presented to the Lebanese ministries and to the healthcare services. This report now stands as a reference for all concerned parties for the purpose of public awareness on the use of drugs in Lebanon, as well as prevention and intervention programming. Idraac's largest project to date is the Lebanon Study. This study is the first national study on mental health that represents the whole of the Lebanese population. The study was conducted in association with Harvard University and the World Health Organization. 27 other countries have also conducted the same study. Idraac trained and used hundreds of interviewers in order to complete 2,857 interviews in all regions of Lebanon. This study has provided Idraac and the Lebanese with a lot of important and alarming data. For example, that 1 out of every 6 Lebanese has had a mental disorder in the past year, and of those, only 1 in 10 obtain treatment. The results of this study are very important for the knowledge they offer us about the mental health of Lebanese and should be addressed on a national level in order to plan for mental health care. In partnership with multiple organizations such as the WHO and IMC, Idraac offered specialized trainings in mental health for different healthcare providers. We believe it is essential to give caregivers at least the basic knowledge about mental health topics. Idraac is also an official World Health Organization training center for the Arabic Composite International Diagnostic Interview, or CD, that is the instrument used in the nationally representative study conducted by Idraac. In early 2006, Idraac trained health workers and professionals in mental health from Gaza, the West Bank, and Iraq on the use of the Arabic CD, so their respective teams could use it in their own national surveys. Idraac's research is put to use through planning and implementing community programs that will benefit the whole nation and raise the much-needed awareness about mental health. Idraac, as a Lebanese NGO, continuously strives to improve the sector of mental health by conducting research that will allow us to better explore and understand the mental health of Lebanese and to effectively advise policy planners on the best ways to plan for health care.